Hey everyone, so this is a webinar for all things headaches and migraines. Novera Headache Center is a center that's specializing in helping patients with headaches and migraines get off medication and back to the life that they want to enjoy. And we are serving specifically the Colorado Springs area, but we see patients from all over. I'm Dr. Taves. The things that we're going to cover today are what the current standard of practice is for someone that has headaches and migraines, how they're diagnosed, a few of the different categories of medications, why it's important to evaluate the neck, and then how that evaluation can lead to a diagnosis and potentially allow you to live life without headaches or migraines. So let's jump into it. The first thing I want to talk about is the current standard of care. So if you have a headache or a migraine, right now, the diagnosis for a headache or migraine is made based off of your symptoms, meaning they will run, if you go to your primary care doctor or the emergency room or urgent care, they will run x-rays, MRIs, CT scans, blood work, depending on your situation and how your symptoms present. Generally, though, they're not going to find anything. They may find certain things on the MRI that look irritated or inflamed. The x-ray might show some wear and tear in certain areas of the spine based on your age. But generally, there's no reason for you to have the headache and migraine based off of those images. And so what happens after that is patients are prescribed different medications, and they start with the kind of over-the-counter pain meds like ibuprofen or Aleve. And then they work up from there to more of the prescription-based, like opioid-type medications, and then there's all different classifications. So let's take a step back. The diagnosis, like I said, is based off of symptoms. So if you look at the different classifications of headaches and migraines, there's dozens, if not hundreds, of different types. So tension-type headache, migraines, cluster headaches, these are the three kind of big ones that most people will fall under. The migraine category, there's a few different things that indicate if it's a migraine. That's the intensity of the pain, if it's one-sided, if you have nausea, sensitivities to lights and sounds, or if you have an aura that's associated with it, that kind of visual disturbance before. If you have a headache that's kind of both sides, starts in the back of the neck and wraps up around the head, then that's going to be diagnosed more as a tension-type headache. Potentially, they'll send you to a physical therapist. That migraine category is pretty much just going to receive medications, maybe Botox. And then the cluster headache is a very intense, intermittent, meaning it comes and goes. And these are more likely to be seen in men. But migraines and really headaches in general, women are 2 to 3 times more likely to experience these. So it's and they oftentimes start after puberty. So let's say middle school or high school girl will start to develop migraines when she's school-aged. And then oftentimes my patients are in their 30s and 40s, and they talk about how they've had them since they were young. And they receive that diagnosis based off their symptoms, and they've been receiving a series of medications ever since. So that's kind of the current scenario. Now let's jump into the different types of classifications of medications and what you might receive. So there's 2 different types of medications. There's preventative and then abortive. So the preventative types are the ones that you'll take oftentimes daily, and they are trying to reduce the frequency and the intensity of your symptoms. And then the abortives are the ones that they'll instruct you to take within 2-hour window of you having your aura or any symptoms, and oftentimes those will work to decrease the severity or actually totally abort the symptoms that you were having, and hopefully you can avoid a migraine. So these medications have their place, and they definitely can be effective. The new one is a medication that is injected into your leg oftentimes, or just some part of the body, and it's taken once a month, and it actually shuts off a protein that transmits pain. And so all these medications are kind of treating the symptoms in different ways. And so whether it's calming down nerves or actually treating kind of that pain response the body has, It's a chemical way of treating how our body responds to pain, and they can be very effective. But what happens is they all have their side effects. And patients will come to me and they'll say, you know, I've been on these medications, but I'm getting to the point where I want to try something new. I have these side effects that are associated with them. I don't like taking medications, but I can't live without them because my migraines are so bad, and I need another option. So that takes us to the evaluation of the neck and why it's important. Why it's important to understand how the neck moves and why it needs to be evaluated appropriately. So let's go back to the diagnosis and how it's based off of symptoms, and you'll go through all of that different imaging and maybe blood work. The thing that can be missed, though, is how we evaluate neck movement and how the neck is moving. So the top 3 bones in the neck interact and allow us to, actually the top 2 do most of our rotation, up and down movement, side to side. They do the bulk of the movement. We have 7 different bones, and each of those interacts to allow us to turn our head all the way, look up and down and side to side, but most of it comes from the top 2. These 2 bones, because they're the most mobile, are also going to have the less stability, and so in the instance of a whiplash injury or prolonged poor posturing or whatever it may be, they are going to be the ones that suffer from that, and oftentimes leading to dysfunction. Dysfunction means that they don't move like they should, and we do know that the first 3 bones in the neck, if they're aggravated, if there's a pain signal that's sent from that area, it's very common to experience what's called referred pain. So this is pain that the brain is perceiving a signal, and the brain thinks that it's coming from somewhere else rather than the area that it was sent from. So if you think of the top 3 bones in the neck, and what I'll do is I will show you here on my model. So I'll kind of zoom out. So this is Mr. Bones here. If we zoom in, so here we have the 7 different bones in the neck, and I'll highlight the top one here. So this one here is called the atlas. The head sits right on the atlas, and the interaction that it has is allows us to nod like this. We should have about 10 degrees of motion, allowing us to say yes. Now, if that's locked up, it's not like we can't say yes. We just use these other joints in the neck to allow us to do that. So it's really important to make sure we have 10 degrees of this nodding motion. Second, we have C2. This is called the axis. And the reason it's called the axis is because there's a little green kind of thumb, if you'll see it sticking up there, and the atlas sits right on it and it rotates. Left and right about 45 degrees each direction. So it does half of our full rotation just through this one joint. Now, if you walk into your doctor's office and they have you turn your head all the way to the left and right, chances are you're not going to stop at 45 degrees if you're not getting movement through there, because the rest of those bones in the neck can pick up from the lost work in the upper part, meaning you're just putting a lot more stress through the rest of the segments of your neck, even though that's not moving. So, because we know that you can have a pain signal sent from this area of the neck when it doesn't move like it should, and that pain signal can show up like a headache, and if it's intense enough and it's gone on for long enough, it can show up with all the symptoms of a migraine, meaning the sensitivities to lights and sounds, the nausea, the aura, the visual disturbance that comes with a migraine, and then it's typically one-sided and kind of a very intense sensation. I have patients that come into the clinic and we discuss these things, and I'll show them the same model on the iPad and evaluate their neck and show them that C1 and C2, they're not rotating like they should. And as I'm doing that technique, it'll reproduce their headache or their migraine symptoms right there in the clinic. Now, if that patient was truly having a vascular problem that only needed medication, then I wouldn't be able to do anything with it. So the problem is that from the beginning, the neck was not evaluated appropriately to show if these segments of the neck were truly moving like they should or not. Most of my patients have never seen a provider that's ever talked about this stuff or properly evaluated it. And so that's what we at Novera Headache Center do, is if a patient comes in and they could have just a mild headache to severe migraines. Most of our patients have 10 plus years of migraines, and it can be a couple times a week or a couple times a month, and they fluctuate. So then maybe they've had a few bad years and a few good years. Everyone's story is a little bit different. Their pain can be one-sided or both sides. They can have the aura, and then all their triggers are different as well, meaning if it's connected to hormones, barometric pressure changes, different foods that they have in their diet. Sometimes it's heat or direct sunlight can trigger their migraine. Our patients have all of these common triggers that you might be experiencing yourself. The way I explain triggers are that if we have this problem with our neck and it's sending a pain signal into the head, there are different things as we go about our day that'll lower our body's threshold for tolerating that pain. So think of the barometric pressure changing and someone with a knee replacement or arthritis in their knee being able to sense an achiness in their knee and knowing that the weather's changing. So same is true with the neck. And you're going to likely experience a headache or a migraine on that day. The other thing is with hormones, it's likely that around changing in hormones is also a change in our threshold for tolerating pain. So there's all sorts of different types of triggers, and each of those can be explained by a changing our threshold of what we experience. And then on those days, we're more likely to have that pain signal that's sent to the brain actually be acknowledged. And so it's important, no matter how you present, if you have headaches or migraines, to have your neck evaluated appropriately to see if we have full mobility or if your neck is just compensating with the rest of those bones doing double the work. Now, the great thing about this is that if it is a problem that's stemming from the neck and we can evaluate it very quickly, just in one visit, the chances are that if we restore that mobility, our patients will see significant, if not total, relief of those headaches or migraines. It's a very life-changing thing when you can take someone outside of the 2 to 3 migraines a week and they're stuck taking their medication and they have the side effects and their life is just totally transformed by these migraines to a state of being hopeful and free and being able to get back to their life. All because we were able to evaluate the neck appropriately and treat it. So we're not a standard physical therapy clinic, and that's what I would encourage anyone to take the step of having your neck properly evaluated. I can't emphasize this enough. No matter how headaches and migraines present, it's very simple process. It's not invasive. It's essentially we go through this discussion, I hear your symptoms, and then it's a simple hands-on technique to see how much mobility you have, seeing maybe if we can reproduce your symptoms and make sense of this pain that you're having through a movement approach. So as a physical therapist, I'm trained in how to evaluate and restore movement problems just like any other therapist. But here at Novera, we specialize in headaches and migraines, and then also jaw pain, neck pain, and dizziness, which fall under the same sort of category of commonly a neck problem and how the neck will present if it's not working like it should. So that's our webinar. I would encourage you to either call us or take advantage of our free discovery visit that we have on our website. This allows us to hear your story. It's a half an hour of my time. Because I'm so passionate about helping this population, we say that because you don't feel heard oftentimes, we want to start with totally free sessions so that you're just feel heard. And if we want to move into an evaluation to see how this specifically fits your situation, then we can do that from there. So thanks for watching, and I hope we see you in the clinic soon.